Hello, we are going to be talking about Mr. Jones. He is a 40-year-old African American male who has a long-standing history of high blood pressure. He is a police officer. He drinks several beers every night. He has gained 20 pounds in the last year, and he has family history of high blood pressure and diabetes and still does not watch his diet. Unfortunately, Mr. Jones has several risk factors that set him up for cardiovascular disease. He is middle-aged male, he is African American, he drinks alcohol, he doesn't exercise very much, he has a very stressful job, and he does not watch his diet. And then you put on top of that the fact that both of his parents died from high blood pressure and his mother also had diabetes, and he is at great risk for cardiovascular disease. According to our textbook, hypertension is sustained high blood pressure, and it is the leading cause of cardiovascular disease, heart attack, stroke, coronary artery disease. Poorly controlled hypertension causes vasoconstriction, which is narrowing of the blood vessels. And after time, that vasoconstriction causes thickening of the blood vessel walls, therefore narrowing the vessels even more, causing the blood pressure to go even higher. Primary hypertension is the most common, and it comes on gradually. Most people don't even realize that they have high blood pressure. They call it the silent killer because most symptoms, if they do have any symptoms, are vague, like a headache, malaise, fatigue, and maybe some dizziness. Because of this, it doesn't get caught early, and the vasoconstriction leads to poor perfusion to vital organs and can cause organ damage. Secondary hypertension is caused by something else. So you have kidney disease, endocrine disorders, illegal drug use such as amphetamines or cocaine, and even some medications can cause elevated blood pressure. With secondary hypertension, it does not respond as quickly to the normal dosages of antihypertensive medications, and sometimes it takes several of those to get the blood pressure under control. One of the complications that comes with primary hypertension is metabolic syndrome. And the reason for that is high blood pressure, hypertension causes an insulin resistant state, which means that there's a lot of glucose in the blood instead of going into the cells and being used by the cells. And this causes even more damage to the blood vessels and the organs. Metabolic syndrome is a combination of high blood pressure, diabetes, and hyperlipidemia. And Mr. Jones is at risk of having metabolic syndrome because of his high blood pressure, his poor diet, and his family history. People who have hypertension, primary hypertension, have significantly higher fasting blood glucose levels than others in their age group who do not have high blood pressure. A study recently found that even those people who just have a high normal blood pressure, they're not hypertensive yet, they even have an increased risk of diabetes because of that insulin resistant state caused by a higher blood pressure. Insulin sensitivity is determined by several factors, including age, ethnicity, weight, body fat percentage, diet, and exercise. So, in order to help Mr. Jones, I would first try to explain to him what exactly the blood pressure means. So, the blood pressure is simply how hard your heart has to work to push your blood through your body. The systolic blood pressure is the top number, and that is the contraction phase of the heart. The diastolic is the bottom number, and that is the relaxation phase of the heart. I would also explain to him what is a normal blood pressure, what is a higher than normal blood pressure or hypertensive blood pressure, and what blood pressure indicates that he should be seen in the emergency room because he's in hypertensive crisis. I would also encourage Mr. Jones to talk with his primary care provider about getting some blood work done, hemoglobin A1C, fasting blood glucose, and lipid panel triglycerides, and also possibly a cardiology consult, especially since he's been having shortness of breath with exertion, because that could mean that he's in advanced stages of that the hypertension is causing cardiovascular disease and he might have congestive heart failure. I would also explain to Mr. Jones that his lifestyle needs to change, that he needs to cut back on his drinking or stop completely, that he needs to exercise more, that he needs to eat a heart healthy diet, he needs to reduce his sodium intake, he needs to reduce his saturated fat intake, and he needs to increase his fiber and water consumption. The exercise factor is very important because exercise releases endorphins, which reduces stress, and it forces the muscles to use glucose for energy, taking it out of the bloodstream and making it be used by the cells, increasing insulin sensitivity and decreasing insulin resistance. Exercise improves cardiovascular health and it also aids in weight loss. I found an excellent table on the American Heart Association website that explains very clearly what a normal blood pressure is, what's elevated, hypertension stage 1 and 2, and what is hypertensive crisis. And I would lead him to that website so that he could learn more about his condition.